tonight or this afternoon is Dr. Leigh Taylor. She's the Assistant Program Administrator at Middle Tennessee School of Anesthesia. In addition to her administrative duties, she teaches the evidence-based practice course series. I noticed a lot of our new 2023 students are on here, so thank you all for coming. You'll get a taste of what Dr. Taylor has for you in the classroom. Dr. Taylor loves teaching students that evidence-based practice is attainable and not something to be frightened over. She maintains employment with AMG, working at St. Thomas West, and has been affiliated with AMG since December 2013. When not working, she is an avid podcast listener, fiction reader, and loves spending time with her husband, 3 kids, and golden retriever. I'll turn it over to Dr. Taylor.
Thank you, Lindsay. I appreciate that introduction. And I want to say thank you to Lindsay and to Jim for asking me to speak today. I've never had the opportunity to do one of these events, and I'm really excited to spend some time with you all. And now is the most stressful part of the presentation, where I attempt to share my screen. So bear with me for just a second. Okay, hopefully you see my presentation and no longer my children.
Yes.
So, wonderful. One thing I pride myself on here at MTSA is that I never want to forget what it's like to be a student. So when I tried to put this presentation together, I time warped myself back to 2010 when I was ready to apply to MTSA, and I was really nervous about clinical. Did I have what it would take to be a CRNA? I didn't know the answer to that. My only real experience had been spent as shadowing. And so I hope my presentation today gives you an idea of what it will take to be successful in clinical here at MTSA. So I wanted to start with my contact information. As Lindsay said, I am the Assistant Program Administrator here. You'll see my email and my phone number. It's best to contact me by email if you have any questions. And this is a picture of me on our beautiful campus. And Lindsay mentioned in that nice introduction about my administrative duties. One of my main job responsibilities here is managing and coordinating with clinical sites. I work with students who may need remediation of skills. I make sure we're in compliance with all of our standards set by our accrediting body, the Council on Accreditation for Nurse Anesthesia. So clinical is something that is a big part of my day-to-day practice as a CRNA, but also in my job duties here at MTSA. So I got this idea because I've been watching a lot of David Letterman on Netflix. Unfortunately, this presentation is not going to be near as funny as he is. But before we get going, I know Lindsay pointed out, I know we've had a few people join since then, but if you have any questions during the presentation, just click on the little bubble and type in your question. I have 2 devices, so I am monitoring the chat as we're doing this presentation. Lindsay is probably moderating it as well, so we'll get your questions answered either throughout or at the end. I thought we would start with a little about our clinical sites and a lot of the frequently asked questions that I get about clinical. So first, when do I start clinical? Traditionally, in non-COVID times, our first semester has always been online. We have an intensive week. It's usually the first week of January, where everyone comes to campus. We orient you to all of our IT, to our instructors, to our handbook. And then the remaining of that semester is completely online in an asynchronous setting, meaning it's designed for you to continue to work and be a full-time student. The second semester would start in May, and that's when you come to campus. We have full-time classes, and it is heavy in simulation. That's where we're preparing you to go and start clinical. You learn induction sequences, you learn how to intubate, you become familiar with the anesthesia machine, And then in September, which is semester 3, that's when you would start clinical in our variety of clinical settings. So how many clinical settings are there? Right now, we have about 18. That's on the high end. Since I've been here at MTSA, we have had as few as 14. But right now, we're at about 18 clinical sites that we go to. Will I go to every clinical site? No, not necessarily. But everyone does go to the Vanderbilt Medical Center. Will I compete with anesthesia residents over cases? No. Vanderbilt is really our only clinical site where there are anesthesia residents, and it is so large and so many different opportunities that it's rare that there is competition over cases. And if there is competition, such as cardiac, we have designated clinical sites and settings for those specialty rotations. So everyone completes their own OB rotation, their own trauma rotation, their own pediatric rotation, and OB and cardiac. So that's really unique to MTSA, is that we focus on those specialty parts of anesthesia. What stands out about MTSA, SRNAs, and clinical? In my opinion, clinical is our biggest strength at MTSA. We graduate students that are adaptable and clinically well prepared. I'll give you an example. My first week as a CRNA, my very first case was an inguinal hernia repair. Pretty easy. It was an LMA, very healthy patient. My second case was a carotid endarterectomy. That's definitely a higher level, more advanced case. And I felt very comfortable my first week after graduation performing independently. Has COVID affected clinical at all? Yes. When elective surgery stopped in Tennessee, clinical also stopped for us for around a month. I'm happy to report, though, that our class of 2020 that is going to graduate next month, they have received all their hours and cases required for graduation. Our anesthesia community here in Nashville has really rallied around our students. So if this does happen again, I see our community reacting the same way and prioritizing our students, prioritizing the cases that they need, and getting those students what they need to graduate. So just in summary, I think there are very few cases, anesthesia machines, equipment that you wouldn't see while you're a student at MTSA. These are pictures of our clinical sites at Vanderbilt. The main Vanderbilt campus is in probably the Hillsborough Village area of Nashville, and the Children's Hospital is right next to it. They each have some ancillary sites that our students get to go to. And then the last one, which is here at the bottom, the Vanderbilt Outpatient Surgery Center, this is one of our newer clinical sites. They only do orthopedic same-day surgeries, and they're located about 20 minutes south of Nashville in Franklin. These are our clinical sites that are affiliated with Anesthesia Medical Group, one of the largest anesthesia practices in Nashville. They do a really nice job streamlining their practice with each clinical site. So what you experience at St. Thomas Midtown would be very similar to what you would experience at St. Thomas West, but each has differences and things that stand out about them, and you get a sense of familiarity as you go between all these different sites. And then this is our last bunch of clinical sites. They have a different practice management, whether they are an independent CRNA only practice or they're run by another anesthesia management group. And you can see kind of where they're located. They're all within the radius of Nashville, and all of our clinical sites are measured from their location to the school. So I want to pause on this slide for a minute and talk about why clinical is so important. The only way I can really explain that to you is by highlighting the nurse anesthesia scope of practice. CRNAs are advanced practice registered nurses that are licensed as independent practitioners. CRNAs plan and deliver anesthesia. We provide pain management through regional techniques, and we care for patients across the lifespan, neonate all the way up to our geriatric patients. We are autonomous providers that work in a variety of healthcare locations. We can hold a variety of roles such as leaders, administrators, teachers, researchers, mentors, and advocates. As a CRNA, my independent professional judgment is exercised through my scope of practice, and I'm held accountable for all the services and actions that I complete in clinical practice. It is well documented that CRNAs provide high quality, cost-effective care, and we're going to continue to be leaders for our patients. So I just want you to take a look at this diagram, and you're going to really see the very important and critical parts of our practice. And I encourage you to revisit this that you can find on our AANA website, because it gives you a very real picture of what you're signing up for. And the last part I want to focus on are the requirements for clinical hours. To graduate from a nurse anesthesia program, a minimum number of clinical hours is 2,000. At MTSA, we routinely graduate well over that. Preparing for this presentation, I thought it would be interesting to run my own report to see how many hours I graduated with, and I graduated with 3,120. That's over 1,000 hours required more than the minimum. So I wanted to paint a very realistic picture here that you have to work hard, but the reward of being a CRNA and getting to practice with this scope of practice is truly worth it. So with that, let's get into my top 10 tips on how to be successful in clinical. And as Lindsay said at the beginning, I love podcasts. So I really need to give credit where credit is due. From the Head of the Bed podcast and then the ACRAC podcast. These are two of my favorite podcasts for anesthesia related content. The From the Head of the Bed podcast was started by a student in a nurse anesthesia program. And so he has a lot of podcasts that are applicable to the student, the SRNA. The ACRAC podcast, a little bit higher level. It's aimed for anesthesia residents, anesthesiologists, CRNAs. But, you know, they have some really great podcasts about the transition from the novice to expert. And so a lot of my tips for you today, I have to give credit to these two podcasts because I've listened to them and really absorbed some of their tips. So number one, be on time. I go back to the saying, early is on time is late, and late is unacceptable. Your first impression for your clinical preceptor is setting your tone for the day. So I want you to kind of think about your time maybe working with nursing students. When you were an ICU nurse and you had a nursing student with you, what that felt like. Our volunteer clinical preceptors are not making any extra money to precept you. And being on time is the first way to show them your commitment to clinical. It also sets your first impression with your patient. As anesthesia providers, we're really limited on the amount of time we have with an awake, cognizant patient. So you have to think, what kind of provider do you want to be? Do you want to be the one who's rushing around and maybe scaring your patient? Or are you going to get there early so that you're not stressed and you're not going to miss out on an opportunity? So number one, be on time. Number two, have good work ethic. Work ethic. I feel like that is a phrase that we throw around a lot, but what does it really mean? So I spent some time today reflecting on what I would define as work ethic skills. And I came up with this list: reliability, dedication, discipline, productivity, cooperation, integrity, responsibility, and professionalism. And I really want to highlight these last three. Our integrity is all we have as CRNAs. We are independent providers. No one is looking over my shoulder, making sure I gave the antibiotics when I needed to. We have big responsibilities in this profession. Clinical is where you learn those responsibilities, but you have to be professional. You need to speak up when asked, and you need to speak out when appropriate. And this is a phrase you're going to hear over and over at MTSA. Every day is a job interview. And let me tell you, very few people land in my office over clinical skills or chipping a tooth or cutting a lip or a lack of knowledge. What lands students in trouble is a lack of work ethic. So you have to approach clinical that every day is a job interview and to approach it with good work ethic. And lastly, the nurse anesthesia community is very small. You know, you'll hear you're joining an elite profession, but what does that mean? So just to put it in perspective, there are approximately 300,000 nurse practitioners in the United States. There are only around 45,000 CRNAs. So we are a small community, and it's very important to have good work ethic. Number 3, put in effort. Effort is a vigorous or determined attempt. So go back to what I said before. Preceptors that you're working with in the clinical setting, they want to see you making an effort and not wasting their time. I think back about a student named David Ribello. He graduated in 2018, and I used to hear him say to prospective students all the times that in order to be a student here, you needed to have H's and T's. And that's a play on ACLS. I'm sure you all know that. But his H's and T's were hunger, humility, time, throughout. In order to be successful, you have to be hungry and you have to want this in your career. And part of that is putting in the effort all the time. And I'm going to come back to humility later. Number 4, be aware of your body language. Dr. Maharabian is a psychologist, and he studied messages and how we perceive these messages and our feelings from these messages. And through a lot of his work, he devised this formula. He concluded that the interpretation of a message is 7% verbal, 38% vocal, and 55% visual. So 93% of communication is nonverbal in nature. Therefore, most of our message is conveyed by nonverbal cues, not by our words. Now, I want you to look at this picture. It is a little bit grainy, but I want you to look at their faces. We wear a mask. We wear eyewear. Sometimes our foreheads are covered up, definitely in scrubs. So it's really important that you pay attention to your body language and how you're presenting yourself in clinical. And I want to tell you a story about this. Several years ago, I was working with a student and we had a patient with a known difficult airway. The patient was morbidly obese and had a abandoned intubation attempt in the OR. So we really spent a lot of time optimizing this patient. We did stuff to the OR table to maximize our attempt to intubate. We drew up several different drugs. We had several different types of tools ready. The students spent a lot of time preparing for this intubation. We then brought the patient in to the operating room. We connected the patient to the monitors. We were ready to start our induction. We were ready to intubate this patient. And I called the anesthesiologist to the bedside because it's all hands on deck when you have a difficult intubation. And the student assumed the position at the front, at the head of the table, ready to intubate the patient. And the anesthesiologist walked in and he said, no, the student will not intubate this patient. Leigh, take over. You're going to intubate the patient. And the student, while she had set up all of that for the patient, had prepared and was ready, she was told she couldn't do it because the anesthesiologist didn't know her. And at that point, a good choice would have been to say, yes, I understand. We need to do what's best for the patient. Well, instead, she said, fine, snapped her gloves off of her hands and stormed out of the operating room and slammed the door. So you really need to be aware of your body language, because she had that opportunity and then she just made the situation worse for herself because she was not being aware of her body language. Number 5, show up with energy. So this is easily one of my biggest pet peeves. I know it's exhausting being a student. I know it because I've done it. I don't want to hear how tired you are in class. 3 kids, I'm very tired too. I get it. You have to let that go and show up every day in clinical with energy. The student who brings the energy is the one who stands out. And that's the student who gets pulled out of operating rooms to do more procedures and to get to see unique situations. So tell me, let's look at these 2 students. Which student would you rather work with? The student that says, I'm so tired, I didn't sleep last night, I need another cup of coffee, we have an exam today. Or do you want to work with the student that says, I'm excited to do this case, I've never done one before. Can I watch you do the interscalene block before my 9 a.m. case? Hi, I'm Leigh. I'm the SRNA working with you today. Would you prefer an element A or an ET tube? I want to work with the SRNA number 2 because, like I said, I'm tired too. We're all tired, but you have to show up with energy in order to get those unique and different opportunities. Number 6, have a good attitude. Now, it might be cliche, but I want to read these 3 quotes. I think it's very important. The only difference between a good day and a bad day is your attitude. Life is 10% what happens to you and 90% how you react to it. If you don't like something, change it. If you can't change it, change your attitude. So when you apply to work at a hospital as a CRNA, you go through this long credentialing process to be granted what's called clinical privileges. We cannot forget that caring for our patients at their most vulnerable state is a privilege. You are definitely going to have a bad day, and you're definitely going to have an off day as a student. But it's your attitude about that bad day that defines you as a student and a practitioner. Are you going to let it beat you up, or are you going to use it as a motivator to show up better the next day? Are you going to go home and sit in front of the couch and watch Netflix? Or are you going to go home and say, man, I didn't know that question that they asked me today. I'm going to look it up so I'm prepared for the next day and I'm going to be better. So number 6, have a good attitude. Number 7, bring the passion. Passion is a little bit different than effort, which we've already talked about today. Passion is what motivates us. I see so many applicants willing to do whatever it takes to get into school, but then they get here and they don't want to stand out. Standing out is a good thing. I want you to hear that. Standing out is a good thing. It shows that you are passionate about your choice. We want to work with students that ask questions, and by asking questions, that's how you learn. We want you to be positive and assertive. That's who we are as CRNAs. We are at the head of the bed and the operating room looks to us for clinical decisions. But we can't teach you the passion. It's got to come within you. So it's very important that if you want to come to MTSA, that being a CRNA is what's for you. And I put these 2 pictures here specifically talking about passion. So this is a picture after our intensive week, and you can see the people who are passionate and excited to be here. They're the ones waving their arms. And I love this tree. This is a tree that I used to could see out my office window, and I just think it's beautiful, and it makes me feel very great for my job here at MTSA. I definitely have a passion for what I do. And when you have a passion for your job, it's not a job, it's a career, and you're excited to come to work. And I want that for everybody. So number 7, bring the passion. Number 8, be coachable. So this goes back to David Rubello, who I talked about earlier, his H's and T's. And it's really about the H, humility. So when you were in the ICU, or you are still in the ICU, it's likely you are an expert. Your colleagues come to you for help. They come to you for advice about how to take care of the patients. Maybe you are very familiar with all the doctors that come through your ICU. Now that's going to change when you become a student at MTSA. In the OR, you become the novice, and you're in a whole new arena. You're going to have new experiences that you've never heard of before. You're going to learn things that you never thought existed. Let me give you an example. I just heard a student today say to Dr. Sharkey, one of our professors, you know, you were talking about the sphincter of Odie the other day in class, and I didn't think that that was important, but today I was asked to give glucagon about the sphincter of Odie. You know, we aren't, I was like, yeah, sometimes we're saying things that are important up here. And that's okay. We're all learning, and you're going to make that transition from the novice learner to the expert learner at the end, but we're all learners. And the way that you become a good learner is by being coachable and taking that constructive criticism. It's important that you're humble and not defensive. And it's also important to ask for feedback. If you aren't getting criticism in clinical, it's not because you've mastered everything. It's likely you're just with a CRNA who, for some reason, is not speaking up or not giving you the feedback. You've got to take ownership for your, and part of that is being coachable and humble in learning and improving. Number 9, go the extra mile. So here at MTSA, we change clinical sites about every 4 to 8 weeks. And I think there's a tendency to stay within our comfort zone. For example, if today was my first day, I might want to sign up to do this easy case that is a laparoscopic cholecystectomy because I know how to do that case. I want to show the preceptors that I'm capable of intubating. I want to show them that I know how to manage this patient, and I also know when to emerge them. But pretend with me that with that laparoscopic cholecystectomy, there's also a thymectomy with a median sternotomy on the board. Now that is a case that you would get to see them open the chest. You would get to see the lungs. That is a new opportunity and a case that doesn't come around. So it's really important that you push yourself to learn and to see new cases, new preceptors, and new comorbidities. You have to push yourself outside of your comfort zone in order to learn and to improve. And I put on here, offer to restock supplies. You know, I think as a ICU nurse, I thought, I'm going to go to anesthesia and then I'm never going to have to clean a patient. I'm not going to have to do any more grunt work. I'm going to be a CRNA. Well, please hear me. There is a lot of grunt work in anesthesia. There is a lot of turning over your room, cleaning your machine, cleaning your supply area. And up until about a year ago, the surgery center I work with, we had to wash our own laryngoscope blades. So talk about that being kind of gross. You can't be above any skill or surgery or opportunity, because that's where you're going to shine. If you can show preceptors that you're willing to go the extra mile, you're willing to do the work, that's when you're going to get pulled in and say, hey, let me show you how to do this. Let me show you this because I see that you are committed to your education and I want to teach you this. Last, number 10, be prepared. So here at MTSA, we're going to give you the tools. We have top-notch instructors in the classroom that are going to direct you to the knowledge. We have top-notch instructors in simulation that are going to give you the sequences and the steps. But it's up to you to practice, apply, and go deeper into that knowledge in order to be a prepared and competent practitioner. You have to put the time in outside of the classroom and to learn the knowledge necessary to practice. So it's up to you. You have to take ownership in order to be prepared, in order to go to clinical and practice. So before we close, I want to ask you, how many of these top 10 tips are within your control? All of them. So it feels very Star Wars, Jedi of me to say, but you truly control your destiny at MTSA. If you want to have good clinical experiences, if you want to be successful in clinical, then it's up to you to put the work, the time, and how you react to getting that feedback and those experiences in order to be successful. So this is another common question I get. What about if I'm working with a difficult CRNA? What if I make a mistake? What if I have a bad day? Well, I put these pictures here because, like I've said, we have really wonderful faculty here at MTSA, and it is extremely rare for a student to not have a bad day. We are learning. You are going to have a bad day. You are going to make mistakes. You are going to work with somebody who doesn't have the same personality as you, and for some reason, you just can't work together. And that's when you come and you talk to one of our faculty. Every student here gets paired with a faculty mentor. So you would have a mentor that you would meet with once a semester. You talk about your performance in class, in simulation, and in clinical. And they are a resource for you that first year to have those difficult conversations. Hey, I'm struggling with this. Can you help me be better? I have seen Dr. Miller, who is this is Dr. Miller with me at our graduation regalia. She is always willing to go into the simulation lab, run sequences, give feedback, and help students with clinical skills. And we have a policy here at MTSA. Our door is always open. Unfortunately, our door is not always open right now because of COVID, and we're trying to be safe in that. But we are always here. We are always willing to talk to you and help you and give you feedback. And I'm going to send my PowerPoint to Lindsay to distribute to everybody who was here today. I've enclosed some resources that I think are really helpful and really useful for you to look at to understand the role of the CRNA. That's very important, because if you understand that, then you understand why clinical is so important. And I'll just close again with my contact information. And I'm going to stop sharing my screen, and we'll see if we can figure out how to unmute everybody. I think I've stopped sharing. And I think I can unmute everybody to answer some questions. Maybe. Well, Lindsay, I don't know how to unmute everyone.
Aaron's in here with me, our IT. So we're masked on here, and he's working to unmute everyone, but I do have controls too. In fact, everybody who's attending, you should be able to unmute yourselves as well.
Well, yeah, so if you just want to click your microphone, then I am more than happy to answer any questions. I know there are some students here that are starting in January, so maybe you have some questions specific about clinical, or maybe you have a question about how to be a better applicant. Anything can be on the table.
And you're welcome to use the chat also if you feel more comfortable.
I see that Keller, one of our class of 2022, posted that she thinks that the head of the bed is so helpful for explaining things to students. So yeah, podcast. I think, you know, when I was a student here, the way we were told to prepare for starting school was to buy an anesthesia textbook and start reading. That's good too. But I feel like I do a lot of driving and going on walks, and a podcast is a really quick, easy way, and it's free in order to gain a lot of good knowledge. Well, don't be shy. Feel free to ask anything.
Okay, Dr. Taylor, my name is
Yeah.
Natalie, and I'm starting the class in January. And thanks, first of all, for hosting this. That was very beneficial. I appreciate it. I just have a lot of anxiety over coming to clinical. And I guess my biggest question is like, what does the clinical day look like? Are we there with other students? Do we know our preceptor beforehand? Are we with the same preceptor the entire few? What does that look like?
That is such a great question. So I feel like it's a three-part question. So let me see if I can break it down a little bit. One, you are not alone in the anxiety that surrounds clinical. And I just want to point out that everyone feels that way, whether they say it or not. Everyone is nervous about starting clinical. I definitely remember my hands shaking the first time I was like putting an IV in a patient. I'm like, I used to do IV therapy. Why is this scary for me? This should not be scary, but everyone feels that way. So you're not alone in the anxiety about clinical. Number two, I think you asked, will I know my clinical preceptor the night before? Will I know my case? Not necessarily. So Vanderbilt is our only clinical site that you would know your preceptor and your case the night before. So that's really nice because you can prepare for that, right? You could look up the, you could look up the case. You could ask your classmates, hey, do you know how this person likes to practice? But it's kind of a double-edged sword because then you're held to a little bit higher standard. You're expected to know and you're expected to look up and be prepared when you show up at clinical. But Vanderbilt is really our only clinical site that it's like that. Our other clinical settings, it changes depending on where you are. Some of them, there are multiple students there, so it's nice to carpool. It's nice to have a buddy to walk in with so you don't get lost. There are some clinical sites where you might be the only SRNA there. And a typical day look like? So if we can pretend that we're at a clinical setting where you don't know your case the night before, a lot of times you show up between 5:30, 5:45, and you're one of the first people there. And maybe someone has made your assignment for you by putting your name by the OR board, or maybe you would have to sign up for what you want to do. So you would get an orientation to the clinical site on what that expectation is. But let's just say you get to choose. So you would go to the operating, the OR board, and you would say, okay, this case looks like something that I want to do. I'm going to write my name on it. And then the next steps are doing a machine check, getting your drugs prepped, getting prepared for that case. And then you would go see your patient. You would do your pre-op interview, potentially start an IV. And usually CRNAs start arriving around 6:30 in the morning. And most of the first cases need to be in the operating room by 7:30. So Natalie, did I hit all the parts of your question?
Yeah, that's very helpful. Thank you.
Good. And I think a lot of the anxiety is the unknown. And I just want to tell you that you're expected to not know a lot when you first start at clinical. It's expected that anesthesia providers are kinesthetic learners. We really need to be hands-on in order to get that knowledge and be able to perform. So what I tell students is it's okay to say, I don't know the answer to that. It's okay to say, I've never done that before. What's not okay is to say, yeah, I've done that before, and then to not know how to do it. And you can leave your camera on. I love cats, so.
I am actually, I'm so sorry.
No, I love cats. No, I apologize.
Like center of attention. You're definitely not alone with anxiety. I also, I guess this doesn't really pertain to, no, it doesn't pertain to like clinical sites, but I feel like right now, yes, I'm still working and whatnot, but I'm like getting anxiety just anticipating starting in January. So is there anything I can do like right now to like better prepare myself? Or any kind of like, I don't know.
Yeah, I can look at that two different ways. One, anxiety can be a good thing. It can motivate us. It can push us outside our comfort zone. So try to reframe your thought behind it as, yes, I'm anxious, but I'm also excited. This is a really exciting new time and new beginning, and you're starting a whole new career. And I think that's just really powerful. And then to answer your question about what you could be doing right now, I'm going to tell you my answer. Well, actually, I'm going to tell you Dr. Gentry's answer first. Dr. Gentry, the program director, he will tell you to read, get your hands on as much material as possible, really start getting a baseline understanding of what's going to be taught to you here in the program. And I'm not saying that's a bad thing. My advice is to prepare as best you can in other ways. Make sure you have a backup plan. Is your car in good shape? You're going to be doing a lot of driving. You know, do you have all the technology you need to be successful in the program? Meaning, is your computer up to date? Do you have a printer? Do you have a good clinical bag? Do you have all the scrubs you need? Try to do as much as you can before you get in this program. Make sure you've gone to the dentist and you've gone for any kind of yearly appointments you might need to do, glasses, that kind of thing. And then I've given you some podcasts that have really great resources. Check them out. I think there's some really good things, especially about how to transition from RN to SRNA. And I think it's required, but meeting with our financial aid department is also very helpful, making sure that you've made a budget and you're financially prepared for that 3-year commitment of being in school.
Perfect. Thank you so much.
Yeah, and I'll deny it if anybody says that I don't read, but reading is also good.
Dr. Taylor, we have a question in the chat.
Okay.
How much experience will we get with regional anesthesia, like nerve blocks?
Excellent. That's a great question. So our Council on Accreditation is who accredits all nurse anesthesia programs. And so the requirement is 10 sticks. Now, 9 of the 10 sticks can come from cadaver labs. We are unique at MTSA that you get the opportunity to be in a cadaver lab. That was not an experience I got to have as a student. It's something that Dr. Johnson has brought here, and it's definitely unique to MTSA compared to other programs. And I'm really jealous of you guys to get to do it. It's very cool. So 9 of them can be from cadaver sticks. 1 has to be on a actual patient. We used to have a designated regional rotation where you would go and you would get a lot of opportunity to do regional. Well, we have several sites now that allow that. So we've taken away the regional rotation, and we encourage you to show up prepared at every clinical site ready to do regional, because you never know when you're going to have that opportunity. Just because a site isn't designated regional rotation doesn't mean that you wouldn't get to do a regional anesthesia. So I don't know if I can give you specific numbers, but we haven't had anyone that, since I've been here, so 3 years, we haven't had anyone have trouble getting those numbers. Good question.
Dr. Taylor, just to kind of piggyback on that, I know they'll have at least 2 cadaver lab experiences during the regional rotation, which gives them a lot of opportunity. And they'll have a 3rd opportunity throughout the year when they come back and do more regional as well. So as you've stated, their numbers will definitely be attainable easily just through the cadaver lab as well, along with the regional rotation.
Thank you, Dr. Miller. Appreciate that. Don't be shy. This is your time. Ask away. And it doesn't have to be related to clinical. If you have questions about didactics or anything else with the program, I'm happy to answer those as well.
Well, Dr. Taylor, I was just reviewing our attendees list, and a lot of them are enrolled students. So that, as far as the admission questions and things like that, that typically we receive a lot of those. We've got seasoned veterans here, so.
Right. Well, good. Then you guys who came are going to be even more prepared starting in January. I'm really excited to, you know, we don't know what next year is going to look like as far as COVID. Speaking of anxiety, have a lot of anxiety about that. And we had already decided that the intensive week is going to be held virtually. And we think that's safest for those people who are traveling and not making you travel here. And then the first semester was always designed to be online. So really, nothing much is changing for you next year until May. As far as what second semester will look like, we just don't know. Our hope and what we've been doing right now is operating at a 50% capacity. So half of the students come to campus for a week, and then the next week, the other half of the students come to class. We're able to stay 6 feet away in that capacity in the classroom. Masks are mandated here on campus. You can see that I don't have a mask. Lindsay doesn't have a mask on. We're alone in our offices. So that is acceptable. If there was somebody in here, then I would have to put a mask on, and I would definitely do that. But we just don't know what May is going to look like. We have a really fun, probably my second favorite event that we do usually in May, which is a family day. And we weren't able to do that this past year. And I don't know what it's going to look like for next year.
There's also, to kind of piggyback on that, there's a question, are all classes online right now? No, they are not.
Right. So like I was saying, 50% of the class comes to campus, and the instructor's in the front of the classroom, and that 50% knows nothing different. It feels just like I don't like to say the word normal, but it feels like a normal classroom experience, while the others are enrolled in, we have right now on Teams. They have this format where they can ask questions and interact with the students in the classroom and the instructor. Everything is recorded. It's nice. The students can go back and watch the recording from the classroom, which I think is really a nice feature. And we have had some students come to me and Dr. Gentry and say, hey, I am not an online learner. I need to be in the classroom. And we've made accommodations for that as well. My class, so I teach the evidence-based practice courses. It's a lot of group work. And one thing you cannot do is be 6 feet apart in a group of 4 or 5 on campus. I haven't figured out how to do that. So my class is the only class in the religion class that is fully online.
Okay. Did you see there's another question, back to the online question. Do you have any tips for taking courses online? That's for an upcoming student.
I can't see the chat for some reason now. Can you repeat that, Lindsay? I'm sorry.
Do you have any tips for taking course online for that first semester?
Sure. Get a planner, get organized, because a lot of you are still going to be working and managing these multiple classes. You're going to take advanced physiology. You're going to have a pharmacology class, health assessment, an intro to the nurse anesthesia profession. So you have a lot of really important foundational courses. And like I said, we've designed that first semester for you to continue to work. So there are exams. You would have 3 or 4 days to take an exam instead of the exam is Tuesday at 5. That's not feasible for someone who's working. So you really need to get a planner, put your work schedule in there, put all your assignments as soon as you get your syllabus and your outline from the courses, put all that in there so you know, hey, this is a busy week of exams and I have to work 2 12-hour shifts at the beginning of the week. So I need to start studying the week prior. I think that would be my best tip about the first semester, is being as organized as possible. And I think a lot of people go into the semester saying, yes, I'm going to work full time and still do the coursework. And then they say, you know, this is too much for me. I'm going to go to a PRN status at work. And that's fine too. You are not required to work that first semester. You are required to pass your courses. So just keep that in mind approaching that first semester.
Another question, what are some common mistakes that you see CRNA make during their first time in clinical?
Yeah, I think I alluded to that a little bit. The common mistakes I see are not speaking up and saying, I am uncomfortable doing this. I've never done this before. You have to be comfortable with that language. You have to be comfortable with saying, I don't know the answer to that question. I haven't learned that yet, or I'm going to go home and look that up tonight because I don't know the answer to that. Those things need to be commonplace in your language, because what I see that people get in trouble for is doing things outside their scope as a student, speaking against what you've been taught, or saying this is how I should do it. So I think that's a real common mistake. And then going back to that work ethic that I mentioned, a lot of the issues that we see are professionalism. And for me, that's the easiest thing. If I can be true to myself, if I can take that criticism, know that I'm novice, know that I'm still learning, and approach clinical as I expect to not do well today, and I expect to be taught how to do something, then you're not going to make the mistakes. The mistakes come when people try to get defensive or argumentative.
Good advice. Another question, I am planning on applying in January. What's the number one tip to give myself the best chance of acceptance?
Wow, that's a really loaded question. So we've got on our website, you can see the definite things you need to have in order to apply. We do have some early interview criteria, that those are also on the website. Take a look at those. Look at what GRE we're looking for. Look at what GPA we're looking for. If you're able to, get some shadowing experience, and don't worry if your GPA isn't that 3.5, or if you don't get a GRE of 150 verbal, don't let that hold you back from applying. Just know that those are things that we do look at. Those are benchmarks we look at for the admissions program. And if you, for some reason, don't get an interview or you don't get admitted into the program, those are things that you could improve for the next year.
Good. Thank you all for your questions.
I'm for some reason not able to see the chat feature. It says I'm not a part of the group.
That was my fault. I was trying to mute the notifications and I had to send an SOS to IT and I didn't want it to go off. So I cut you off so
Okay.
you wouldn't hear the ding.
Okay. Well, I was just going to say, I'm sorry I can't see you're having to read it to me.
That's fine. I'm happy to read it to you. But there isn't another question. Just to make the most of everybody's time, we'll give, I guess just wrap this up at 5. So I encourage you all, if you've been holding back with any questions, you're welcome to unmute your microphone, or you can put it in the chat. Do you have any closing remarks that you'd like to add?
Yeah, I think the last thing I'd like to say is just I appreciate your engagement and your willingness to show up at 4 o'clock, 5 o'clock on I think it's Thursday afternoon. And, you know, being a CRNA has been one of the defining moments of my life. And I put that tree in my PowerPoint. I really show up every day grateful that I've been given this opportunity, and I just hope that for everybody. I hope that everybody can find something that they feel as passionate about as I do. So you all have my contact information, and I mean it. You're more than welcome to email me. Lindsay is a wonderful resource. If you have admissions questions, she's on it, and we'll get back to you.
Yes, please feel free to email me. My name of how I spell my name is a little difficult, so I always like to just put out admissions@mtsa.edu is a great way to remember to email me directly. And our phone number and my email is on the website as well. And
if anybody wants a copy of my PowerPoint, I'm happy to send that to Lindsay, or you can email me directly and ask for a copy. I'd be happy to share it with you.
And I will share it with everyone, or this recording with everyone who registered today. We'll either keep it as a video or convert it to like a podcast, and we'll get it sent out to everybody who participated. And Dr. Taylor had a great suggestion. We're going to do a random drawing of everyone who attended today and send out a gift for one lucky winner, an MTSA t-shirt. So I might be contacting you for your shirt size and get you some MTSA swag for participating today. Again, thank you all for attending, and I've really enjoyed this process, and I've loved seeing everybody's faces. And have a good weekend, and please don't hesitate to reach out.
Yeah, and happy Thanksgiving. Thank you, everybody. Thanks for listening.
Thanks so much.
Thank you.